afternoon, ma'am. I'm Marc Villaceran, student doctor. May I ask for your name, age, and birthday, please?
Yes, Marc Alanis, 22 years old, February 9th, 1999.
For today, I'll be assessing your head and neck, and for me to do that, I would have to ask for your consent to touch parts of your head, eyes, ears, nose, and throat. Would that be okay with you?
Yes.
So first, I would like to ask some questions regarding your past and current symptoms. Then we'll proceed with the physical examination. Do not worry, after each part of the examination, proper hand hygiene and instrument cleaning on my part will be administered. Is that okay with you?
Yes.
Rest assured that all of our examination findings will be strictly confidential between me and your main physician. Are you ready to start?
Yes.
Okay, let's get started. Ms. Alanis, have you had any headaches recently?
Yes.
Can you please describe them?
They've been sudden but not too severe. They usually happen around the same time of the day, like in the afternoon.
Okay. Do you have any other symptoms with your headache, like pain, weakening, or numbness in your arms and legs?
No.
Can you point to me to the area where you feel the headaches occurring?
I usually feel it like right here, on this part.
Okay. Does anything affect your headache, like coughing, sneezing, or changing the position of your head?
No.
Do you have any family history with your headaches?
No.
Okay. And how about your vision? How has it been?
It's been good.
How about your hearing? Have you had any trouble with your ears?
No, sir.
How about your nose and sinuses? Have they been normal?
They've been normal.
And lastly, how about your mouth, throat, and neck? Anything unusual occurring with them?
Nothing unusual.
Okay, thank you for answering my questions. We shall proceed with the physical examination. So first, I'll examine your head. Tell me, have you noticed anything wrong with your scalp or hair recently?
No, not really.
And just letting you know, some parts of the exam involve me touching and palpating parts of your head and face. Is that okay with you?
Yes.
Thank you. Now I'll start the examination. I'll now examine your eyes. We'll be specifically testing for visual acuity, visual fields, the conjunctiva, sclera, cornea, lens, pupils, extraocular movements, and the fundi. Just letting you know, some parts of the exam include bright light being shown to your eyes. Are you comfortable with that?
Yes.
Okay, thank you. We'll now begin this portion of the exam. I'll now test your visual acuity. Please cover one eye using this blank card. And try to read the smallest line of print possible, okay?
D-E-F-P-O-T-E-C.
Okay, now please cover the other eye and try to read the same line but backwards, please.
C-E-T-O-P-F-E-D.
Thank you. I'll be now testing your visual fields. Can you please cover one eye, please? And just stare at my open eye, okay? And just tell me when you see any finger movements.
Okay. I see it. I see it.
Very good. Can you cover your other eye, please? Thank you.
I see it. I see it.
Okay, very good. Now, while covering one of your eyes, please tell me when the pen appears to be red, okay?
Mm-hmm. I see it. I see it. I see it. I see it.
Okay, other part, please.
I see it. I see it. I see it. I see it.
Thank you very much. I'll just be inspecting a few parts of your eyes now. Just look straight ahead at me. Keep looking straight. Can you blink for me? Thank you. Can you just please look up for me? Okay. Can you please look to the side and down for me, please?
Mm-hmm.
Thank you. Okay, Miss Alanis, just look straight forward at me. I'm just going to be shining this light, okay?
Okay.
Okay, Miss Alanis, I'm just going to be shining this bright light. Just make sure to look into the far distance. I'm just going to be measuring your pupils, okay?
Okay.
Just look straight ahead for me, please. I'm just going to be shining this light into your eye. Okay. Now follow my finger without moving your head, okay?
Mm-hmm.
I will now examine your ears. I'll be specifically testing your auricle, ear canal, drum, and your auditory acuity. Just letting you know that this portion of the exam involves me touching, pulling, and inserting the otoscope in your ear. Will you be comfortable with that?
Yes.
Okay, thank you. Let's proceed. I will now use the otoscope to look into your ear canal, okay?
Okay.
I'll be testing your auditory acuity now. I'll be saying a combination of 3 letters or numbers, and I want you to repeat what you hear, okay? I'll be covering one ear at a time to test for it.
Okay.
Can you please repeat it for me?
3, 1.
Very good. I'm doing the other ear now.
Mm-hmm.
Can you please repeat it for me?
7P4.
Thank you very much.
For patients who failed the whispered voice test, the Weber and Ryan test may help determine if the hearing loss is conductive or sensorineural in origin. To conduct these tests, make sure the room is quiet and use a tuning fork of 512 Hz. Set the fork into a light vibration to test for lateralization. The Weber test is done by placing the base of the tuning fork firmly on top of the patient's head or on the mid-forehead. Ask where the patient hears the sound on one or both sides. Normally, the vibration is heard in the midline or equally in both ears. For the Ryan test, place the base of the tuning fork on the mastoid bone behind the ear and level with the canal. When the patient can no longer hear the sound, quickly place the fork closer to the ear canal and ask if the patient hears a vibration. Here, the U of the fork should face forward, which maximizes sound transmission for the patient. Normally, the sound is heard longer through air than through bone.
Examine your nose and sinuses. I'll be specifically testing if there's any asymmetry or deformity of the nose, nasal obstruction, checking southern nerves and presence of sinus tenderness. There will be some parts of the exam where I'll use the otoscope to see more clearly inside of your nose, but don't worry, it shouldn't hurt. Is that okay with you?
Yes.
Thank you. Let's start. Can you breathe in for me, please? Can you do it again? I'm just going to tilt your head, okay?
Mm-hmm.
We'll just be palpating to check your sinuses, okay?
Mm-hmm.
Thank you. I'll now examine your mouth and pharynx. I'll be specifically testing the lips, oral mucosa, gums, teeth, roof and floor of the mouth, tongue, and the pharynx. There will be some parts of the exam where I have to hold on to parts of your mouth and tongue. It should not hurt. Is that okay with you?
Yes.
Thank you. Let's start. Please open up your mouth, please. I'm going to insert this tongue blade, okay?
Okay.
Lift up your tongue, please. Keep opening your mouth. Alright, can you please stick out your tongue? I'm just going to be checking both sides using this gauze, okay?
Mm-hmm.
Can you open your mouth once again? Can you please say ah?
Ah.
Keep going, please.
Ah.
Alright. I'll be inspecting your neck. Can you please look up for me?
Mm-hmm.
I'll be palpating for your lymph nodes. Is that okay with you?
Mm-hmm.
I'm going to go right behind you and put my hands around your neck. I'm just going to be checking for your thyroid, okay?
Okay.
Breathe in for me. One more time. Okay. There's a cup of water there. Can you please take a sip for me?
Yes.
Thank you very much. That's it for our head and neck exam. Thank you so much for your cooperation. Do you have any questions for me?
No.
I'll be back shortly with your results after I discuss the findings with the healthcare team. Thank you very much, Ms. Alanis.
Thank you.